So I'm here today with Professor Jane Hutton. She's probably known to many of you already, but Jane is a medical statistician. I'm just going to read a short biography of her before we begin. Professor Hutton's research interests include meta-analysis, survival analysis, and ethics in mathematics, and she has participated in highly cited studies on autism and cerebral palsy. She's a professor of statistics at the University of Warwick. She also frequently visits the African Institute for Mathematical Sciences in South Africa as a volunteer statistics instructor. Jane read mathematics and statistics at the University of Edinburgh, earning a bachelor's degree with first-class honours in 1982. After studying for a diploma in mathematical studies at the University of Cambridge, she earned a PhD at Imperial College London in 1986. Her dissertation, Non-Negative Time Series and Shot Noise Processes as Models for Dry Rivers, was supervised by David Cox. She worked at the University of Liverpool from 1986 to 1995 and at Newcastle University from 1996 to 2000 before moving to the University of Warwick in 2000. So, first of all, thank you very much for joining us today.
It's good to be asked to discuss this.
Absolutely. So you'll obviously be a familiar figure to many people because you've been in the ITV documentary, but we're going to just talk a little bit about your background first, because I'm always interested in how people got into a certain field. So could you tell me a little bit about when you first became interested in maths and statistics?
So essentially, I guess I would say I was a born mathematician. I mean, most of my colleagues would be the same. If you can do maths, you basically can do maths. And so I guess I first became interested in maths probably about the stage I could count. And I probably carried on from there because I used to always just play maths games with my father as a child.
Yeah,
Follow up reading about mathematics and things like that.
yeah. I think conversely, if you can't do maths, then you don't tend to get good at it later on. It's my
No, it's not. You might or might not take pride in the amount of work you've done, but the ability, I think, is something you're born with.
yeah,
If
I
you're born
agree.
with it, that's nice.
Absolutely. So could you discuss some of the projects that you've worked on in your professional career and your areas of interest and expertise as a statistician?
Yes. So apart from my PhD, most of my work has been around medical statistics and areas coming out of that. So while I was in Cambridge, I did, in fact, for my dissertation, I did a couple of medical related projects, one of which was actually about artificial lung surfactant for premature infants. The data came from Professor Colin Morley, and I was working with Sheila Gore, as she was then, Sheila Bird now. So that was my first introduction to neonatal medicine and the statistics in it. And then I got involved in various things during the 9 years or so in Liverpool because we provided a consulting service to the medical school. One of the long-running projects actually came from my medical department, head of department, Peter Farrow, who is committed to pediatric epidemiology and particularly interested in cerebral palsy and cretinism. And so the first research grant I got was recording all the people on a register he had so that we could find out when they died, so that we could get some better idea of how long children who are born with cerebral palsy will live. That involves survival analysis, which was part of the statistical modelling that I was interested in doing and developing. I'd also got quite a lot, well, we had quite a lot of consultations generally from the paediatricians, people associated with Liverpool Women's Hospital and care of very prem infants, but also quite a lot from neurology. So I got involved in research related to epilepsy. That spanned quite a number of projects for PhD students. Quite a number of my PhD students have developed models which allow us to better understand epilepsy. And my most recent PhD student, I need to work on updating some of the work of modelling information about treatment of epilepsy. The cerebral palsy led to, because we published a paper on how long people with cerebral palsy live, that attracted attention from the legal world because the most expensive, the largest part of the NHS litigation services liabilities actually comes from cases where liability in managing a pregnancy is admitted and the child is born with cerebral palsy because they will need a lot of care. Before we published, and a couple of other people published at very similar time, medical doctors, pediatricians, would be asked to estimate the life expectancy, and they would say things like, "Oh, I don't think the child will reach double figures." One pediatrician, a medical stats colleague of mine, recorded saying, "None of my patients are aged over 18, so I don't think any of these children will live beyond 18. Didn't seem to occur to her as a pediatrician. Might have something to do with the upper age limit of her patients. So initially I just worked on cerebral palsy, but the other main group in the world in California did other neurological injuries. So I started to expand to that. And then gradually it's expanded a bit more for the life expectancy because people start asking about somebody who was in a traffic accident, but they were also a lifelong smoker or they were obese. I've been involved in a couple of cases that are not life expectancy. David Chadwick and I've got Tony Marson in Liverpool made a huge difference to people with epilepsy. They're really committed to that. And we did a lot of joint work. And that meant that when there was a court case about the drug vigabatrin, which affects people's sight, I was involved in that. And I've also got involved in a couple of other personal injury, but more commercial cases, clinical trials, metal on metal hip replacement. The other thing I was also very interested in early on was ethics and statistics, partly because I'd been interested in philosophy from an early age, and partly because I also got a grant. There's a call for a number of topics to be investigated, one of which was how randomized controlled trials are understood and managed in different social and cultural contexts. So I've written, I don't know, about a dozen articles or papers about statistics and ethics and knowledge. One of those was published 30 years ago, Statistics is Essential for Professional Ethics. And I sketched that out in terms of the medical profession. On my list of things to do is to write a revised version of that related to the legal profession, which seems to be rather less numerate and logical than one would like them to be.
Yeah, that's really interesting. So you obviously have an enormous grounding in medical cases. I think that's quite
Yes.
clear. I didn't know you'd work with Professor Colin Morley, actually. So that's
Yes.
interesting. Yeah.
I'm not sure whether he remembers me, but we
Well,
didn't meet personally. It was his data I worked with, to be
I would
fair.
have asked him if I'd have known, but I'll ask him at some point.
Mm.
So that's really interesting. So usually at this point, I ask people how they first heard about Lucy Letby, but in your case, we don't need to do that, as we know that you first heard about it when the police contacted you. So I'm going to ask you some questions about that whole process. I wasn't sure, and I'm still not sure what you will be able to say and what you won't be able to say, but as you've okayed these questions, I presume you can say something. So could you tell me what occurred at that time when the police contacted you?
So I had an email on the 22nd of March 2018 saying that my name had been given, they'd been searching for somebody, my name had come up for the medico legal side of things, and that they were investigating a spike in the number of babies collapsing and dying in a neonatal unit at a hospital, and that they'd collected substantial material, and what they wanted was somebody to help them understand and assess the chances of sheer coincidence, and possibly with comparisons to other universities, other hospitals.
Yeah.
So I responded and arranged to have a conversation, as well as asking what information was available. And very early on, I said, the correct approach is very well established, been established since 1980, of how you investigate these things. And I explained what the correct approach was and what the correct question to ask was, which is, if you have a cluster of events, what are the possible explanations and which is the most likely? So yes, obviously you have to go through procedures setting up contracts, both in terms of fees and in terms of confidentiality and non-disclosure. So at that stage, I wasn't even seeing anything. And the first thing was simply seeing on a screen the numbers of deaths. Essentially, those are the figures that Professor Sir David Spiegelhalter discussed in his submission to Thirlwell. And he got exactly the same answer as I did in terms of, yes, there was a spike in numbers, and yes, you needed to investigate. But of course, that's what you need to do. You need to investigate. You don't assume we've had a spike, therefore there must be a murderer.
No.
Funnily enough, I think it was about 1990 when I was at Liverpool, I was asked to give a talk to a medical group precisely about small numbers and how they can affect things. And in that, I used an example that if you were looking at children's unit, and one year you'd had 3 deaths, and the next year you'd had 8 deaths, that one of the first things you needed to do was to look into it. And if you found that, there'd been a sudden increase in vitro fertilization, and you'd had, in the second year, you'd had quintuplets and then triplets, you have a difficult question, because they're not just simply 8 deaths. If we're thinking about how frequently are these are 2 pregnancies and 8 deaths, but that's not the same as 8 singleton deaths. So it isn't a question of saying there's a high rate, somebody must be to blame. There's a high rate, what is happening? And so to be asked, can you come up with a figure like 1 in a million that there's one particular person present? It's completely the wrong question. And of course, it's an echo of the Sally Clark mistake that was made by a retired paediatrician in the late 90s. So yes, we set up contracts, we had discussions, and I was fairly busy with quite a few things. So I was rather surprised that we kept not getting the information. And I followed it up occasionally, but I certainly didn't pursue it actively. I didn't have the capacity. I was quite surprised that the police arrested Letby at a stage when, as far as I knew, they couldn't possibly have had valid evidence against her. But yes, as I say, I was very busy. And then in 2021, thereabouts, I think I started getting messages from colleagues, because I was the chair of the Royal Statistical Society Stats and Law section, and various colleagues emailed me and said, look, this case has got into the newspapers, and this looks like a rerun of previous miscarriages of justice. This doesn't look safe, We have the Lucia de Burke case, the Italian case. I've gone blank on the name at the moment.
Daniela Pagliari.
Thank you, Daniela Pagliari. And, a lot of concern. And these, the key players in that are people well known to me and have been discussed quite extensively. And of course, I was also very aware of things like the Bristol Royal Infirmary, where you did have a very high death rate in a paediatric unit. David Spiegelhalter was very involved with the analysis of that. And again, Harold Shipman. So there are occasions when there are very high rates, and there are individual people who are responsible. But there are also occasions when it isn't individual people, and that actually it's some other factor that's been changed. Or indeed, of course, one of the problems can be it's not the presence of a particular person that's a problem, it's the absence of the person. So yes, I basically pointed out what needed to be done, but then carried on being busy with a lot of other things. I mean, one of the early things I did was to say that I would like to get in touch. I wanted permission to get in touch with Peter Sidebotham, who's a paediatrician who worked in child protection and with whom I'd published a paper on violent childhood deaths. And Jenny Korinchuk, who was involved in Embrace, so that's the register of births and deaths, so that you can actually do serious research about what was happening. Because my default is I like working collaboratively. I want to work with pediatricians and so on, so that we can, complement one another. I've published 25 papers in pediatric epidemiology, which I gather is rather more than Dewey Evans has published. But I'm not a medical doctor, so I have fairly decent knowledge of quite a lot of the language, but I would always prefer to work collaboratively with pediatricians, pathologists, so on, whoever is relevant for that particular issue. I didn't get that permission. But the other thing I pointed out very early on was you've got to write down a very precise definition of what you mean by unexpected, or unanticipated or sudden, which I never saw. In fact, I don't think I've yet seen anything in the papers that I've read, and maybe in papers I haven't read. So I got drip-fed things about more babies being included and so on, but not actually the information that was necessary. And I knew, I was very clear about what you needed to be done, because while I was in Liverpool, there was a very nice example of how to do this properly when there were 5 boys with cystic fibrosis. So that's a genetic condition in which you get far too much mucus in the lungs and the gut from birth. So these poor children have a pretty rough time and they have to take a lot of tablets. And in the summer of 1993, the paediatricians in Liverpool Alder Hey Hospital suddenly had 5 cases of boys who needed emergency surgery. And they'd never seen it before. So they had to say, well, why have we got this? Thought about it and consulted my colleague. Sorry.
Nice.
So Ross Smith came and consulted my colleague, Deborah Ashby, and they just went about things in the correct way. And as I say, this is 93. This is 20 years before the Letby thing. The correct way was, okay, that was thought to probably be related to the type of medicine. So they notified the authorities and the Committee of Safety of Medicine. A warning goes out, move your patients off the new meds and back onto the standard. They set up a case control study, set up cohort studies. By January 94, an article was published describing what had happened, so that everybody would know to look out for it. And by about June 95, they'd published the case control study, which confirmed that, yes, it was a change in medication that had caused this. It was also more likely, boys were more likely to experience this problem with their guts than girls. And initially, it looked as though it was more likely to happen at Liverpool Alder Hey Hospital than elsewhere. But that was, in fact, because they were a tertiary referral unit and they'd moved onto the new medicine much earlier than other people. So once you allowed for the dose response, it wasn't associated with Liverpool. And as I say, that was essentially 2 years start to finish. There's no reason why, if the doctors and the management at the Countess of Chester neonatal unit had done what they should have done, according to guidance from the Department of Health in 2011, and called in a statistician, they could have resolved the matter equally, probably within 2 or 3 years, instead of it still being discussed 10 years later.
Absolutely, that's brilliant. So I have a few follow-up questions related to what you've just said. So firstly, could I just ask you to elaborate a little bit on what the correct process would look like? I know you've mentioned that already, but particularly what variables would need to go into a chart such as the one that was produced?
So, as I said, this is where I'd want to collaborate. But basically, you're going to start by saying, um, broad brush. You need to think about what data you want, um, and you need to think about the pregnancy. You know, although I don't think, as far as I know, obstetric history was presented at the court case. The Embrace database collects a lot of information about the mother. So you would have wanted to know about the mother, about how well the pregnancy had gone, whether there were infections or other problems um, as a start. Then you'd want to know about the delivery. Was it emergency? Was it planned? Had it been caused by some problem? One of the things that I studied as I said, when I was at Cambridge, was the use of artificial lung surfactant for premature babies, because little babies' lungs aren't properly developed. But another thing you do is give a mother steroid injections. And so, if there's some warning that a baby is going to be born premature, you want to know whether those steroid injections have been given or not. So all of that is essential information. And then, of course, once the baby is actually born, there's a lot of basic information. Sex, was it the mother's first baby or not? Gestational age, birth weight, singleton or twins or higher? What were the APGAR scores at birth? Why was it the baby admitted to an intensive care unit? What was the care? What was the known, the stated causes of death for any baby who had died? If it was an unexpected event, what were all the expectations that were eliminated? And then in terms of staff, it's essential that you include all staff. So, and you do that anonymously. So you'd want the staff to be coded, and you could do it in two stages, which is initially simply to have the staff coded without any statement as to whether this was the cleaner, the plumber, the consultant, or a nurse, because you can then do a completely, you're minimizing your bias, which is something the forensic science regulator has published on, because it's very important. And then you could have started saying, okay, then we can now look at classes, medical, doctors, nurses, others, consultants or not, because of course, we know from the Royal College of Pediatric and Child Health report that staff not being present could be important. In other words, the consultants only doing 2 ward rounds a week instead of 2 a day. So you might well have wanted to know when was the last time a consultant had seen the infant before they died and things like that. So that's, broadly speaking, those are all the kinds of things you ought to be collecting and considering.
That's great. And again, you did touch on this, but how significant a lot of people have commented to me who are medically qualified that twins and triplets, to the extent that we saw in this case, should not have been born on this unit. So I know you mentioned that you like to have the opinion of a pediatrician, but I'd still be interested to hear your view on how significant you think it is statistically that they had several twins and triplets in this cohort of babies.
That is very important. Anybody who can read the Royal College of Obstetricians and Gynecologists guidance on what are called monochorionic twin pregnancies. They don't mention triplets because that's actually very rare. So monochorionic is a word that won't mean much to most people. It means a lot to me because of my research collaborations in cerebral palsy. And basically what it means is you've only got a single placenta. So 2 babies are sharing 1 blood supply. You could get even more severe things, but in this case, you've just got them sharing a blood supply, and that means you're at risk of what's called twin-to-twin transfusion, or one of the babies can essentially, if you've got a stronger baby, it can effectively begin to take most of the nutrition, and you get very unequal sized babies. I'm actually on the steering group of a large trial that's looking into these kinds of issues. So I'm, quite aware of them. And once you go to triplets, so monochorionic twins are at high risk. I don't know the protocols, I can't remember, about whether with maybe not, it may well be that twins, twins have each got their own placenta, may not be at that high risk for delivery out away from a tertiary neonatal unit. Monochorionic twins, we could look up and see whether the recommendations should be there. But monochorionic triplets, I can't imagine why that pregnancy should have been flagged up early, well before the children were born. And as soon as there was any sign that there was going to need to be an early delivery, it should have been organised to happen either at Arrow Park or at Liverpool Women's Hospital. Okay, you might have emergencies, you can't get to the hospital you would like, and I don't know the background to that. But a paper was published in 2023, and the lead author on that is in fact the lead of this research study that I've just mentioned. And if you have, they've got 153 pregnancies mentioned in that, but it's taken 10 years and 20 international centres to accumulate that number. So we're talking very, very rare. So when you get Mr. Nicholas Johnson, KC, saying this was outside what the doctors expected, of course it was. You've got to think about who should be expecting this, who should have the knowledge for this. The reality is that even if there is essentially no problem with a monochorionic triplet pregnancy, at least one of those babies per pregnancy will die. That's if there's no problems. As soon as you get any of the usual problems, you're talking about, I think, 70-80% of those pregnancies, there will be a death. And of course, what's very important is this point that you actually have to consider the analysis by pregnancy, not as 3 separate deaths. And frankly, it's very sad that the Court of Appeal judges simply repeated the Sally Clark mistake. That was a mistake of saying it's very surprising that 2 of a mother's babies have died of sudden infant death syndrome, which we subsequently know is not correct. But in this case, they're not only saying it's surprising that 2 boys of different ages in the same family have died, they're talking about triplets. Premature triplets. Should you be surprised that they're similar? Are most people surprised that identical twins are similar? And yet that appears twice in the Court of Appeal judgment. It's just, as I say, it's very sad that there doesn't seem to have been any learning about the fact that siblings actually do tend to be quite like one another. And we have genetic and other things in common. So yes, it's incredibly important. I don't think the analysis would have been particularly easy. It would be quite a messy, formal statistical analysis to decide how you'd do the pregnancy outcomes versus twin outcome. You could simplify it by doing it at that level, if the correct data had been collected and were available.
Absolutely, that's great. So you've you've touched on this a little bit, but you've had dealings with the police during this process, and I'm sure you probably expected that it would proceed to the point where you did work for them.
Yes.
So can you recall what the terms or contact or frame of reference was when you began and how the work was presented to you?
Well, the formal contract, which is actually important because that's what was disclosed, just said that Professor Hutton and Dr. Nichols, my colleague, will provide consultancy at this rate. So it didn't mention our professions at all. Right. There's no way any defence barrister reading that would know that we were statisticians, unless they happen to know who we were, and there's no reason to assume that they would. So basically, it was an agreement of an hourly rate, to provide information, and we corresponded, and I said what was needed, and so on. And I just got told, well, they'd have to see what the Crown Prosecution Service wanted to do, because there's an interaction, as I understand it, between the Crown Prosecution Service and the police on these. And so in 2021, so probably a little bit before I was being asked that the Stats and the Law Committee should do something, I got told about, the trial being set and then dates changed for the trial. And then, and that the police had discussed with the prosecution the benefits of statistics as an evidential tool, and I had a meeting arranged, as the Guardian discovered, to discuss the evidence. And then that meeting was cancelled because the Crown Prosecution Service had been told that this meeting was scheduled to discuss the validity of the statistical evidence in the case. And the prosecutor, I got this email saying the prosecutor does not agree with our line of inquiry and has instructed us not to pursue this avenue any further at present. Now, I didn't know then, and I might not have had time even if I did, that was both a breach of the code for Crown prosecution, instructing the police not to get evidence. It is also, as far as I understand, criminal act by the Crown Prosecution Service, because the Police Investigation and something Bill of 1996 specifically says you cannot tell the police to avoid looking into evidence which might provide evidence of innocence of a person. And yet, of course, that's precisely what this instruction by the Crown Prosecution Service did.
Yeah. And just on a broader level, it seems that they should be independent. A police investigation should be independent. The whole point is that the police are supposed to investigate and then pass the evidence to the Crown Prosecution Service, and they're supposed to independently assess whether or not it's a legitimate prosecution. It's not a kind of tandem between the two where they interact, unless the not in this way, where the Crown Prosecution Service is saying, "Oh, don't do that. We don't want you to."
Well, I think I have never been able to get anything sensible out of the CPS. I don't have the energy to try to.
I don't think it's possible, unfortunately.
Well, I guess there should be a detective superintendent or the police commissioner for the relevant area should take an interest in the fact that, as far as we can tell, a crime has been committed. And therefore, it's their responsibility, not mine, to follow it up. I did speak to my MP about it, but she's been very helpful in other matters in the past. But on this one, the response was that I had to get my own legal advice. In other words, go and find solicitors and barristers who are willing to take on the Crown Prosecution Service. And clearly that would take somebody with a fair amount of courage and weight. I mean, clearly, Lord Jonathan Sumption effectively has written very clearly that he was actually quite explicit that he thought Letby is probably innocent. But I can't imagine his fees come in at less than quite a vast amount of money. So, this is a state responsibility. My MP is not prepared to take it on. The Minister for Justice and the Minister for Health were not prepared to respond to my expressions of concern.
Well, I have seen letters from the people sent to MPs. So they've shown them to me, and I said, what you should say now is, what can I do? What can I do to make a difference then? You won't take this on. What should I do? And their answer will typically be, oh, just listen to the Thirlwell inquiry. It's like, well, we're complaining about the Thirlwell inquiry. So it's very difficult, and there seems to be an enormous reluctance for MPs to get involved with this or with similar things. for whatever reason. I know there's supposed to be something of a separation between the two, but the fact is that Parliament does get involved in legal matters all the time. So,
Yeah, Parliament does, and also, I understand why this Criminal Cases Review Commission was set up to be, arm's length,
hmm,
not something where you could feel you could bribe the Prime Minister to do something. On the other hand, it is still answerable to somebody,
yeah,
and the Crown Prosecution Service is very definitely answerable
hmm,
to Parliament. And a simple question from Parliament to the Crown Prosecution Service saying, I would like to know what has happened. It doesn't have to come back to me, but the Minister for Justice should, I think, have looked into this and said, please let me know exactly what happened and who made this instruction. We had a very good talk by Neil Mackenzie, who's a KC in Scotland, about the role of the Crown Prosecution Service in prosecution, which is not to make vitriolic remarks about anybody who's accused of a crime. And yet, the senior CPS lawyer has gone onto the media, sort of speaking very negatively about Lucy Letby.
hmm,
My understanding is that that is not the role. You're not there to demonize a person. You're there to, professionally present a case, which
yeah,
doesn't seem to be quite what has happened.
no, no. Well, on the matter of all these organisations, I always come back to the same thing. They're publicly funded entirely, so
Yes,
they should be publicly accountable by definition.
yes,
And
yeah.
that, and if you like, if I were to, I mean, I've seen some letters written to the Crown Prosecution Service, and they didn't respond to them. So that therefore makes me think, if I wrote to the Crown Prosecution Service, it's very unlikely they would respond to me. So therefore, my only recourse is to go to my MP, and as we know, the MPs don't want to take it on. So that
With the
means,
exception of David Davies, largely. Yeah.
yeah, but that essentially means they're not publicly accountable because
Yes,
they just won't respond to you. So um,
exactly.
to
Yeah.
me, it's very regrettable. I think you could describe it as.
Yeah. I mean, hence my comment about, revising my paper on professional ethics of the legal profession. Um, Undoubtedly could have an interesting discussion about the professional ethics or the ethics, if not professional, of the members of parliament.
Yeah, absolutely. So let's get back to the police investigation. So I don't know if you can say much about this. Obviously, you've mentioned what the Crown Prosecution Service said, but do you have any thoughts about why they didn't proceed? I was going to ask you whether you were surprised, but you've already indicated that you were. So, do you have any thoughts about why they didn't proceed?
I think from my memory of some of the discussions we had and other things that I've seen, there were some of the police officers involved in the case recognised the statistical issues and wanted proper input. But then there were also clearly people who didn't want the appropriate input. So, for example, the consultants didn't. John Gibbs mentioned things. They did some statistics, which I think have shown up in Thirlwell and other places. And frankly, if they didn't know they were doing the wrong thing, they ought to have done. There's extensive stuff in medical education, regulation, Department of Health advice about how to do these things properly. And the sort of Liverpool region has got fairly extensive networks of medical statisticians. They also ought to know that the Health Protection Agency or Health Security England or Health Security Agency, or whatever it feels like being called at the time, that is one of their areas of expertise. It's not an area of expertise of the police.
Absolutely. Um, had you done similar work to this previously? Had you participated in a court case or a police investigation previously?
Um, I usually joke that I don't do crime. I leave it to my other colleagues. Um, I haven't. I haven't done a formal criminal case before. Interesting enough, a couple of approaches have come out of the Letby case. Um, but what I did do was a general medical counsel hearing against three pediatricians, neonatologists, which is much nearer to being like a criminal case. Civil cases, you don't have a jury in general. Obviously, fraud cases, they now dispense with juries if it's a complex case. And in a civil case in England, you will exchange reports with your opposite number and you will have to discuss them and produce a joint report. I don't think that's as common in the criminal side of things. So I have been involved in some quite large and detailed cases, but not on the criminal side.
Yeah, that's fine. So that's really interesting on the police side of things. We're now going to move on to discuss the statistics in the case itself and issues related to that. So firstly, I just simply want to ask you whether you agree that statistics are central to the conviction of Lucy Letby, and if so, could you explain why?
Yes, so it might seem a slight diversion, but if you look at the way the prosecution built up the case, because there was absolutely no evidence of Letby ever doing any child any harm, my understanding is that the medical consultants at the unit and Dewey Evers went looking for something that they could say was harm. And they found the insulin measurements. And if you read the opening prosecution, they say, and the closing, these babies must have had external insulin, therefore it must have come from Letby, even though she wasn't even there on the unit. Which smacks to me of desperation. But then you start looking into that and you look at the way in which the quality of those measurements are done. Now, clearly there are people with expertise in that area who've commented, but I just looked at that as a statistician, one who was quite interested in improving the quality of measurements in labs. And the UK requirement is that for any measurement, provided you're within plus or minus 25%, then that lab is certified. And in fact, the Liverpool lab actually had something that was out by a factor of 8. And in fairness to them, it's very clear on those reports. It's in red. Do not use this to draw this conclusion that there's external insulin. You can't do it. It's not valid. Which, of course, the prosecution completely ignored. But just to come back to those numbers, so I know that most people faced with plus or minus 25% their eyes might glaze over. So it's probably easier to think of a specific example. So a lot of people in this country would say I'm 5'3" tall, but I would say I'm 160 centimeters tall. Now, if you're allowed to get that out by either a quarter, you can either say I'm 120 centimeters tall, under 4 foot, or 2 meters. So 6'6" tall. And that would be regarded as an accurate measurement of my height. Okay, do the same to my weight, 64 kilograms. Well, that could be 48 kilograms to 80 kilograms. Now, that's bad enough, and it's something that I think most juries could understand if you said to them, this is how vague the measurements are. But of course, we use these measurements together, and the point that was made was the expected ratio wasn't what it should have been. Well, colleague has got undergraduate students to analyze the data, and it shows that only a third of measurements are within the expected ratio. So that's wrong anyway. But if you take what I've just said to you about my height and weight, and you say, well, actually, what we're going to look at is body mass index, which is a fairly standard measure of obesity. Quite a lot of people will have heard of it. And that's your weight in kilograms divided by your height in meters squared. So the 64 divided by 1.6 squared, that's 25. So my body mass index is roughly 25. But the laboratory could state my body mass index to be anywhere between 12 and 56. Now at 12, because you're a man, you'd be dead, right? I'm a woman, I might still be alive at 12, but I'd look like something out of Belson. At 56, the Michelin man would look slim in comparison. But that's the quality of evidence that was used to identify the problem. In fact, it was worse than that, because as I recollect, what they were saying was the equivalent of saying, oh, well, Jane Hutton is 64 meters tall and she weighs 1.6 kilograms. It seems they've actually even swapped the units. And, I'm aware that a lot of the legal profession have a minimal understanding of science, but this blind belief and the unwillingness just to ask yourself, why is there a red warning on these tests?
Yeah.
What could go wrong? I don't think that's an action of a responsible Crown Prosecution Service to have ignored those warnings.
I agree. I think the analogy you provided is exceptional because it just makes it so clear that you're talking about the difference between someone being very, very tall or very, very short. And just based on that difference, and I think that's very, very illustrative. So
that was the first bit. So that was set up to say, and of course, manipulated, telling Letby that this was the answer. Is that true? Well, Letby's not qualified in lab sciences. She's under a lot of pressure. What can she do other than saying, if that's what the lab scientists have said, that's what the lab scientists have said? That's not an admission that the things are right. It's just saying, as I will do in court, that is not my area of expertise. And if I say that is not my area of expertise, it does not mean, therefore, I endorse the statement. It means I'm not saying anything about that statement. So you have that. And then, of course, you have, what's the chance of that? You have comments about opening speech. The statistics were fairly usual, but then there was a significant rise. The opening couple of paragraphs uses statistical language. Then you talk about what is expected. Well, how are you going to decide whether something's expected or unexpected? You're going to be essentially thinking in chance or probability terms. And then, of course, you get that notorious chart where you get this must be the explanation, and it's designed visually. It may well have been that chart that that would be my guess, that was the chart that the Cheshire Constabulary wanted to discuss with me and the Crown Prosecution Service instructed them not to discuss with me. And it's set up to look like only one person, all these events. But again, within those events, you've got one child that turns up 4 times. So that's not independent. And you've got you've got the twins and triplets, and you have no information about anything else. You don't even know whether all the nurses, and they were the only ones mentioned, had been there all the time. So if the first event is in January 2015, but nurse Z was only employed from May 2016, well, that's just not a fair comparison. She wasn't there. Physically in the hospital, she wasn't employed. She couldn't have done that. Yeah. And the other problem, of course, is the lack of all the other information about the other possible causes. And this is this is the problem that the Royal Statistical Society pointed out in 1999 and has continued to point out. You've got to ask the right question. And the right question is not, what's the probability that all these events happen, these unexplained, undefined events? Don't forget that we know that Evans changed his mind quite a lot about what was or wasn't happening, even after the trial. But you can't just say, when Ros came to Deborah to talk about the fact there were these sudden 5 emergency surgeries, you didn't say, what's the probability of an event we've never experienced occurring? That's just the wrong question. It doesn't help you find out what's happening to these children. How can we prevent it? The correct thing to do is what they did, which is to say, what are the cases where this did happen, cases where it didn't happen, and what made the difference? Yeah. And that's what you should have done. And that was not done. And you were simply relying on, let's list all the cases when Letby was present, because, of course, if Letby wasn't present, we're going to kick it off the list. So all that chart shows that Letby was present when Letby was present, because if she wasn't present, then we redefined the events. It's a complete tautology, relying on statistics, because you cannot say, what's the chance of that? You cannot have a judge directing a jury to assess the unlikelihood of coincidence, which frankly would be difficult for me to do as a professional statistician with the things that I've mentioned about repeated events, triplets, and so on, let alone a jury. You can't ask people to assess the unlikelihood of coincidence and pretend you've got no statistics in the case.
No.
To say, is it surprising? I've tossed a coin twice. I've got 2 heads. I tossed it another time. I've got 3 heads. Is that surprising? Well, if it's a double-headed coin, no, it's not surprising. If it's a fair coin, it's a bit more surprising. You've got to state the assumptions you're making.
Yes, absolutely. So I have one comment to make on what you just said, and then a follow-up question. So what I would like to add to the insulin aspect of it is that, aside from what you already mentioned, that Lucy gave the only possible reasonable response, is also, had she done the opposite, imagine she said, well, I don't accept that, or I don't agree with that, then
she would have been criticised for being outside of her competence.
Nick Johnson would have made an hour out of that.
Yeah, exactly.
We never would have heard the end of it.
It's like a lot of the other so-called pattern evidence in the case, like, cherry picking what you want from a post-it note, which says, I'm innocent, I'm being persecuted, and, I hate me, I've done this. I mean, that never seemed to me like a confession, because I have a very sad experience. My cousin had a very good friend who is a doctor, and we all happened to be in the Northeast at one time in our lives, and we'd met and we'd had some events, so I knew Mary, and we'd met just before Christmas or New Year, and Mary was a GP, and she produced a depression questionnaire and made a joke about, let's see who's most depressed, and so on. And then on New Year's Eve, I got a phone call from my cousin saying, do you know how to contact so-and-so? Because Mary's just committed suicide. What had happened to Mary was that when she was not planning to be a GP, she was going to be, I think, A&E or something like that. She was in hospital as a junior doctor. There were 2 very sick children. So she couldn't deal with both. She telephoned, the consultant on call, and, others said to the nurse, right, we're going to get another doctor because I've got to look after child A. You need to keep an eye on child B because, we've called the consultant to come in. Went, saved the life of child A, came back and found the consultant hadn't bothered to turn up, and the child died. And she committed suicide because she spent several years after that, 10 years after that, until she couldn't live it anymore, feeling it was her fault that the second baby died. Now, that's irrational, but she was thinking, I should have stopped treating child A and gone out to see that my senior doctor had come and fulfilled his duty. And she could just never shake off the feeling that if only I'd done something, that other child wouldn't have died. So, the comment from Letby seems to me to be entirely possibly within that framework. Everybody's getting at me. Perhaps I did do something wrong. Perhaps I'm not good enough. But there've been people who are professional in these things saying you can't interpret it that way. And it's like, the handover notes. Well, you can't just comment on that. You have to say, how often does this happen? No doctor should ever bring me confidential information, but I told you I was a consultant to the medical people, and the number of doctors who would wander in and dump stuff on my table, sometimes literally paper, sometimes electronic. And you just have to say, get that out of here. You cannot give me that information. So to say, the handover notes is unusual, well, doctors and nurses I've talked to don't say it's unusual. The same friend, Mary, talked about having notes where she's sitting out in the sunshine reading through patient notes. Well, it's probably not on the official approved register. And there was a similar thing where he said, oh, she was still keeping a diary, even though we'd looked at her diary before. Again, you can see if she stopped keeping the diary, it would be treated as suspicious. If she didn't stop treating the diary, it would be treated as suspicious. If you're going to say this is unusual, you must say, what assumptions are you making? What searches on the web are unusual? Why do you say it's unusual? Do you have any evidence that it's unusual? My mother's GP actually turned up at her funeral. That's very unusual, because clearly GPs have got a lot of patients who die. It didn't immediately make me think, oh, he must have killed her.
Yeah.
That's the kind of logic they're doing. She took an interest in the patients and sympathized with the parents, therefore she's a murderer.
Yeah.
Not people were just simply not thinking through the implications of what they're saying and the assumptions they're making in this.
I agree. So you mentioned the Royal Statistical Society in this date of 1999. Recently, they've produced this paper, Healthcare Serial Killer or Coincidence.
Yeah.
Unless that's what you're referring to, but I thought it was significantly more recent than that this was produced.
That was, sorry, the Healthcare Serial Killers was published September 2022. So I'd been asked to do something and I couldn't do it. I just felt that I was still expecting the constabulary to get me to do things. So other colleagues, particularly Peter Green, very kindly pulled it together. I wrote an appendix for it. So that was published September 22 and sent to the defense and the prosecution and other people. We had consulted police and others before we published it.
And do you know why the need was felt to produce this? I mean, was there genuine concern that statistics were being used incorrectly?
There was genuine concern that, yet again, you were seeing the mistakes that had been made before, the mistake made in Sally Clark and Angela Cannings, mistakes made for Daniela Poggieri, for Lucia de Burke and others, yes. That's why the examples are, there are several different examples from different parts of the world. And, of course, the example of Shipman, where there genuinely was a murderer.
Yeah, absolutely. So I've spoken to statisticians previously, and they've really praised this paper and said that it's not only has very strong science in it, but also that it's very clearly presented so that it can be understood by a layperson. So do you see any evidence the prosecution, or indeed anyone involved in the trial, paid any attention to this paper, or the police for that matter?
From everything you can see, I would say that it's been deliberately ignored. I don't think it was published at the stage that the Crown Prosecution Service. It wasn't published at the stage the Crown Prosecution Service said not to investigate the evidence. But it was published in time for it to have been taken into account. And it was not taken into account.
Yeah, that would be my...
They were sent a copy, and that I'm pretty sure, I mean, I wasn't doing that. I'm pretty sure that went in before the trial.
Yeah. I mean, that's my indication. That's what's been indicated. Yeah. So I think that's true. So you often hear these claims made, and Dewi Evans has been one person that has claimed this in particular, that statistics have nothing to do with the case against Lucy Letby. So from what you've told me and from what other people have told me, it's clear that proper mathematical statistics and statisticians should have been involved in this court case. I mean, can you see any justification for these statements by Dewi Evans at all?
There's no justification whatsoever. I mean, I am very familiar with the arrogant ignorance shown by many medics. He's obviously out of touch with medical education, medical practice, audit, medical research, medical regulation. They all cooperate with statistics. And in fact, the Department of Health and the Health Quality Improvement Partnership published something in 2011 on what should you do when you get a spike. And pretty much the first thing that it says it's detection and management of outliers, as I say, published in 2011. And it starts, these recommendations apply to comparison of providers, such as hospital trusts, using batches of data collected over a defined period, both outcome, alive or dead, and process measurements. And the next thing it says is the statistical analysis involved should be carried out by people with appropriate statistical expertise and experience. And it makes it absolutely clear about that. It talks about data quality, and then goes on to case mix adjustment and various other things that are more technical. But it's absolutely clear you've got to get the right quality data from the start, and you've got to involve a statistician from the start. That is the official Department of Health position. Apparently, Dewey Evans, I presume regards the Department of Health and anybody other than himself as just incapable of understanding anything. It's a rather nice comment from Peter Green, saying that it's curious that all the people who say there are no statistics in the Letby case are not statisticians, and that all statisticians say there is statistics and it's very badly done in that statistics. So, if you had lots of medical people saying the medicine was wrong, and all the non-medical people were saying, "Oh no, the medicine is fine," would you not be a little bit concerned?
Yeah, absolutely.
But unfortunately, yes. I mean, there are plenty of people who want to say that because you haven't used a p-value, you haven't said 1 in a million or something, there is no statistics. And they try to tell statisticians how to define statistics, but lawyers don't like it when statisticians tell them what the law is.
Yeah, absolutely. So you appeared in the recent ITV documentary, as I'm sure most people watching this are aware. And during that, I don't know how long the interview you did was. I assume they took a very small proportion of what you said overall.
Yes.
Yeah, that's usually the case. So you made some quite, no, nonetheless, you still made some quite strong statements regarding the statistical case during the bit that was used and some of the inferences that were made by the prosecution. Would you like to expand on some of the comments that you made during the ITV documentary?
You might be better if you can remind me which ones you're thinking about.
So, I mean, essentially, I maybe should have made that a little bit clearer, but I guess the one that stood out to me, obviously, I don't have all the comments in front of me right now, but you really said something along the lines of, this chart has absolutely no merit whatsoever. I don't think you phrased it that way, but you said, I mean, I can't remember the exact phrase you used, but I'm sure you can recall what I'm referring to.
Essentially, that chart that shows 25 lines and certain number of nurses with a purple thing down it. That's what I was just describing. Lord Jonathan Sumption, to be fair, did a very nice, in his Times article, did a very good critique of many points and produced actually a much better quality chart than the Crown Prosecution Service managed to do, or the Cheshire Constabulary. But yeah, the problems are that even within that chart, it's very badly presented. You're not seeing the triplets as triplets. You're getting babies coming in. So you're double and triple counting what's going on. It's like, I'm trying to think of a good analogy. It's like, giving a pound coin to one of your children, then taking it back and giving a pound coin to the next child and the next, and then say, well, I've given them all a pound coin. Well, no, you've given them a coin and taken it away again. You can't ignore what you're doing. So that is one of the very big problems. But equally, it simply isn't the right thing to be doing in the first place, as is very clear from the forensic science regulators' guidance. And actually, this whole episode has made me wonder whether the police and the Crown Prosecution Service and barristers and judges are completely ignorant of the existence of the forensic science regulator. Certainly seem to be either unaware of or unwilling to use the guidance, because the correct question has to be a comparison. We've seen say 7 deaths, or in fact, of course, there are about 13 deaths, what are the possible explanations for this? Just like in the Sally Clark case, we've got 2 dead boys. What are the possible explanations? 2 sudden infant deaths, 1 sudden infant death, 1 murder, 2 murders, 2 deaths from natural causes? You need to think about it. And in the Angela Cannings appeal judgment, where she was acquitted, there's a reference to Justice Jack, I think it is, who points out very clearly and simply that just because an event is rare, unless there is no other possible cause, the rarity is irrelevant. If there are other possible causes, you have to do a comparison, which is exactly what the forensic science regulator says. You have to compare which is more likely. If you've got a unit, which is 23 major problems found by the Royal College of Paediatrics and Child Health, and Dr. Jane Horton has said in 14 out of 17 cases she's looked at, there was major or substantial failure of clinical care. It seems to me that a very plausible explanation is the failure of the unit. Much more plausible explanation than invisible murder by a nurse whom you've selected cases to fit. And again, the idea that you've got a neonatal pathologist who's done a postmortem at the time, and that you can have a retired pediatrician coming in and saying, well, obviously that person was a complete idiot, I'm the only person who knows what's happening. I think the problem is that a number of judges would much rather have a very confident and completely wrong discussion than have somebody saying, we have these possibilities, none of them is certain, this is the balance of evidence in favor of these things. And it's remarkable that the deliberate decisions by, as I understand, Justice Goss, to refuse to allow the jury to hear how bad the unit was, and the fact that the CPS refused to have the statistics done properly.
Yeah, I mean, I find it extraordinary that the Royal College report is not available for the jury. It seems to me that should have been a major factor in the court case that would be discussed by both defence and particularly, obviously, by the defence. But
yes,
the prosecution would have to justify why Dewi Evans has decided that Lucy Letby injected air into the stomach, or was it the vein, or was it this, or was it that, or I've changed my mind again, or was it milk this time, was it fluid, rather than the pages and pages of recommendations and criticisms of the unit.
Particularly as the Royal College report, the consultants had, as I understand, they had actually said they thought it was all Letby's fault. And that report quite specifically says there's no evidence for that.
Yeah, I mean, it even praises her. There's a quite extensive section praising Lucy in that report that was redacted. It's in the Thirlwell documents now. But it seems to me, well, obviously, as we know as well, that would have been in her favour. There were nurses that wanted to speak up in her favour as well. They were essentially barred from the process. I just find it incredible that all of this really important contextual information is just removed by the judge, essentially. Not obviously, it's not the judge's fault the witnesses didn't appear, and then the jury doesn't get to hear about it. But then we're supposed to presume that jury decision is legitimate. I just don't see it in that way.
Certainly, the House of Commons report on the Sally Clark miscarriage of justice and Angela Cannings, that said that it reflected very badly on the legal profession to have allowed this to have happened. I suppose the legal profession is still currently saying that they don't think they've done anything wrong.
Well, it certainly seems that not much has changed.
Yes, exactly. I mean, when I was first approached, when I got the email, I actually thought, praise the Lord, we've been working at this for so long, and now we actually have an approach which allows things to be done correctly. unfortunately, what seems to have happened is everybody has now gone into retreat, curled up and put their prickles out, and is unwilling to do anything
Hmm.
rational.
Did you ever actually hear, did the police actually ever say to you, oh, we're not going to use you now? Or did you just never hear back from them?
The last thing I heard was the Crown Prosecution Service has instructed us not to investigate.
Okay, so they did tell you. But it's interesting. It's very interesting. So
Mm.
I'm going to show you a document now, hopefully. Just bear
Mhm.
with me. It's got to do the technical stuff. So you may very well have seen this before, but let's move this out of the way. So can you see that?
Yeah,
Okay. So what I wanted to show you was um, you have this initial period here.
yeah,
So there's a very quick spike of 3 deaths. Now, when I say spike, I'm using that in inverted commas. It may
yeah.
not meet your statistical standards of a spike, um, but there's a death to 3 infants in 2 weeks, and that's what raises suspicions on the unit. And then
Hmm.
baby E dies here.
But aren't A and B twins?
Yes, yes, it was the same mother, isn't it? Yeah, yeah.
Hmm.
So that's another factor as well. But and then there's kind of a period where there are some attempted murders, and then there's this murder, baby I dies 23rd of October 2015. So that's all within 4 months, okay? And then
Mm.
there's no other murders until here. All of
Mm.
these cases here are very weak indeed.
Yeah.
Um, I'm not saying the other cases are strong, but I mean some of these just should never be anywhere near a courtroom. That's absolutely
Hmm.
clear.
Hmm. Hmm.
And then we have this period here where there's months and months and months with no deaths. Now, what happened in this intervening period here is that there were deaths on the unit, but these were all ruled out of the court case. So
Yeah.
I'll show you the other document here. I mean, again, you've referenced this yourself, but these are the infants that died on the unit, and then there are 4 other infants that the police investigated as well. So you may not know that among these are these two, it won't highlight properly, but there's this infant here that's 40 weeks, there's this infant here that's 39 weeks, and then
Mm.
there's this infant here that's 40 weeks. So these are all full termers
Yeah.
premature who died on the unit.
Yeah.
Um, so all I wanted to ask you, I know it's very difficult and you'd be giving a slightly flippant view based on what I've just presented, but is there even one spike in this case?
Sorry. So,
Is there even one, it's always described by the prosecutors, by the police, by people that are advocates of her guilt, that, oh, there was a spike in deaths. But in actual fact, there's a period here of a few months from here to here, 4 months from here to here. And then
yeah.
there's a big gap where there's no murders in the indictment at all. And then there's another couple here. So
Yeah.
could you even say that is one spike, one universal spike you could describe it as?
Um, so if you were presented it in the form that I was presented, which was actually more deaths, if you're told in 16 months, 18 months, there have been 13 deaths, and previously there weren't, then if you make the assumption that nothing else has changed, you would say there have been more deaths, we should look into it. But as soon as you start looking into it, I think you would have found things like the chaos on the unit, that you were taking. I mean, actually, you really ought to know how many babies on the unit, because one of the easiest things to be happening would be taking more children. I mean, it's not a very big unit, so the actual number of babies on the unit matters. And the next thing you would have to do would be you'd have to look at multiplicity. That so-called spike in June, those are triplets. Those are the triplets.
Hmm.
That's it's profoundly innumerate
Hmm.
to have dealt with this in this way.
Yeah. So that's great. That's satisfactory for that question. I know I've thrust that on you a little bit without showing you it. So thanks. Um, So talking about, I want to ask you about large data sets. So I've already asked several statisticians about this, but I'd like to hear your view on it as well. So I wanted to ask you kind of about the inevitability of how spikes will occur. in large data sets over a period of time, and if you could explain that and talk about that a little bit.
I guess something you might think about for anybody who's, say, commuting to work, might be that, you know, how often do you arrive late because problem with the train or problem with traffic if you're driving, and then you think of everybody, you know, who's on a train or driving. You know, you often think, oh, there's always traffic jams, but you tend to think that when there has been one, not when there hasn't been. And if you were to think about, well, are we likely to have a collection of problems or accidents that cluster together? Well, if you're, I don't know, December 2010 with very heavy snow, surprise, surprise, you've got a spike of flights being cancelled. So you might first see the spike, you then ask, why is it? But if you otherwise just generally look at variation, if you've got pretty small numbers, so you throw a dice and you keep tossing it, you will get a run of sixes at some point, every so often. When you actually ask people, if you do this, which is a kind of thing statisticians do to their students, you ask them to write down 20 random numbers or write down zeros and ones randomly. Most people cannot do it. They will write them down much more uniformly than they come. They tend to think that it's only going to be, you know, uniform if you go 0, 1, 1, 0, 1, 1, 0, 0. They won't put in a run of 5 ones, and yet that's not actually particularly unlikely. You know, there's very good reason why we tend to notice certain things. It tends to be important. You know, it's much more important to notice the one car that's speeding than the several cars that aren't if you're trying to cross the road, or other things like that. But there's plenty of evidence about cognitive bias. It's quoted by the forensic science regulator. People complain about it when they think people are prejudiced because of their, you know, they're only doing this to me because I'm a woman. You know, it might or might not be true. And we know that we're not good. You know, if you're honest, you know that you're not that good at estimating what's happened. If you compare, it's the foundation, actually, of cognitive behavioral therapy. There are people who say nobody ever talks to me and this happens and that happens. They're then asked to go and actually observe what's happening and to see whether it matches with their imagination. And it usually doesn't.
Yeah, I remember, so you just made me remember something that happened to me was, I already mentioned the previous thing that when I went to Canada, I got held in customs on the way back. I got held on the way there as well. And then I was with a massive group of people, and this guy just pulled me to one side and asked, like, questioned me for about 10 minutes about why are you coming to Canada? Why are you doing this? Why are you doing that? And I think he probably pulled me because I was a single male. I don't know, but that's the kind of could be a kind of example of bias in a.
It could be, but equally, it could be that you have, you know, it could be that in fact sort of single white men are the most common of whatever. But it could also be things that you just pick up. So the colleagues I respect in neurology and epilepsy, when statisticians have sat in with them to try to get a better understanding of the data that's being collected and things, and they would quite often say, as a new patient walks in, so this is a patient they've never seen before who's been referred to them, they'll write a diagnosis on the paper as the patient walks in and hand the paper to the statistician, and then they do the whole thing and they come up with the diagnosis. And very often what they've written just on the basis of the person walking into the room is correct. Now, you could call that bias, but actually what's probably happening is they're very, very experienced and they're picking up a whole lot of really quite subtle signs. And most of us do that in our own areas of expertise. You know, if you're in Africa with a guide who's an expert at spotting animals or watching birds, they will see things that you would just never see because they know how to look.
Mm.
So the ability to spot things is very important. The conclusions you draw from that depend on the context.
Mm.
If the guide spots lions and I don't, I shouldn't conclude that lions only come out when the guide is present. It's a possible explanation that lions are only there when he's there, and when he's not there, they all go away and hide. But it's much more likely that he can see things that my eye is not attuned to seeing, which is why in medicine, randomized controlled trials are used and other forms of concealment are used when you're doing case control studies or any other kind of study. We know we have biases. We need them to survive. We can't pay attention to absolutely everything. But when we don't want the biases to affect what we're doing, there are approaches we can use.
Mm. So that reminds me of the fact that in the police film that was made on Operation Hummingbird, and also I think in some of the statements that they've released, they're making these comments about, we were looking for patterns in things, and they talk about her diary. They've never specified this code that is supposedly in a diary. I mean, I'm sure you'd give it very short shrift indeed. I mean, I looked at it and I just thought, I mean, come on, this is utterly ridiculous. There's no code in this diary. There's not even anything of any substance in it. But I do think they really they settled on an explanation early on, and then they just found that it's a classic example of confirmation bias.
Well,
Where
it begins with that because DSI Paul Hughes says, well, of course, we all know that Letby was moved off the ward at the end of June and the death stopped. What he didn't say was the unit was downgraded. They were no longer taking babies they weren't competent to deal with. That is, to my mind, quite deliberately misleading to have said that. And yes, there are not fair comparisons. And towards the end of that, he says we'd done everything we could to give the babies justice, but they had not done everything they could to give Letby justice.
Absolutely.
They had left vast tracts of things undone that would have made it possible to have a trial based on valid and reliable evidence.
Yeah,
That was not done.
another thing they said that you may not be aware of is he makes this comment about, I think it's Paul Hughes, it may have been one of the other police officers. I mean, I've bashed Paul Hughes often enough on this channel. I don't want to do it unjustly, but it's one of the police officers says, oh, you don't often hear about lots of deaths on a neonatal unit. And I was thinking, well, it's usually not a police matter. That's why you don't hear about it, because it's not in the news. There's a medical investigation and they find out there's a medical explanation for it. So consequently, it doesn't become a news story, and you don't hear about it at the police, obviously. So that was another example of them just thinking, wow, this is really unusual. This shouldn't happen. It's like, well, maybe it should if you actually understood contextually what occurred.
Yes, that's the same point. Whether you're saying unexpected or unusual,
Hmm.
stop and think about how are you defining your baseline.
Hmm.
For some people, they might say it's very unusual to have people when you ask, when you make a comment about Fermat's last theorem, it's very unusual for people to understand what you're talking about. But if I were to say that here, where I am at the Isaac Newton Institute, everybody would know what Fermat's last theorem was. So you can't say whether or not something is usual or unusual without having a background read.
Absolutely. So it's just a couple of questions that I'd like to ask you to conclude. The first one is in reference to David Conn's recent Guardian article a few months ago.
I haven't got round to reading, but I must, yeah.
Yeah, it's a good article. I just wanted to mention one. I mean, he interviews Dr. Evans, he mentions various things, but there's one comment in particular that I wanted to ask you about. So he made this statement that the Thirlwell inquiry will likely make recommendations for hospitals to refer spikes in deaths to the police more rapidly. Now, I expect that because I've followed the narrative of Thirlwell and I know what Thirlwell has been doing, so I'm not surprised to read that. But in my view, this is based on what I've seen of the Cheshire Constabulary. incredibly dangerous. But I'd love to hear your opinion on it.
Well, regrettably, such an ignorant or foolish recommendation can't be ruled out, not given the very silly remark that Lady Justice Thirlwell opened the inquiry with. She basically said, it's just noise if statisticians and others criticise us because they haven't sat through every day of the case. Well, this conjures up the image of Lady Justice Thirlwell sitting with her knitting at the top of the Shard and getting a call saying, I'm a structural engineer. I've been called in to look at the foundations. They are crumbling. I suggest you leave. And Lady Justice Thirlwell says, have you been to every room in the Shard? And the civil engineer says, no, but I'm rather rapidly leaving the basement as things are beginning to fall. And she says, well, if you haven't been to every room in the building, how can you know there's a problem? That was the level, unfortunately, of the reasoning that was being used, which I find rather inadequate. Various bodies under the Department of Health are equipped to investigate spikes in deaths. I mentioned the 2011 guidance, which is very clear. The Health Security Agency is exactly the agency which has the right skills. The police and the CPS, they've demonstrated they don't have the resources or the understanding to investigate healthcare clusters. They need epidemiologists, they need statisticians, they need the relevant currently practicing staff like neonatologists and intensive care specialists. There's forensic science regulations, guidance on minimizing cognitive bias, which hasn't been respected as far as one can see by the judges or barristers or police. And if Thirlwell does recommend that, will it also recommend that the Department of Health abandons its own guidance? The Health Security Agency withdraws the Crown copyright publication, guidance for investigating non-infectious disease clusters from potential environmental causes? Are we going to tell the Department of Health to stop professionally investigating things so that the police can do it? Unfortunately, as I say, I can't rule out such an ignorant and foolish recommendation.
Yeah, I don't think I need to add anything to that. So lastly, how do you feel about the Lucy Letby case and her conviction at this time?
It's tragic that the Crown Prosecution Service threw away the opportunities they had to obtain accurate and reliable evidence. It's tragic that the medical consultants and the Countess of Chester management failed to follow well-established procedures that had been around for decades before this problem arose. We should not have had a court case which was going to result in an unsafe conviction because the correct evidence was not available. It's tragic for the individual, of course. It's tragic for all the families. A lot of families might well have been left to grieve and to recover, who've now been stirred up for 10, 11 years with the suggestion that the death of the very premature, very ill babies was deliberate murder, as opposed to, which is not much more consoling, incompetence or simply inevitable. A prem baby, a baby born at 31 weeks weighing a few hundred grams is not a healthy child. It's not actually, it's very sad, but it is not surprising if that child cannot live. And raising parents' retrospective hopes, if you like, by suggesting that it could have been avoided, I think is very cruel. My mother never really recovered from the death of my younger brother. He died at 6 weeks. He was born with spinal bifida. My mother was pretty sure that what had happened, because that was what happened in the 60s, was that a doctor had told a nurse to turn him over and suffocate him because he had spinal bifida. My mother had a brother who'd had polio, wore calipers, but after World War II developed a business putting up aerials on roofs. So her thought about a child with spinal bifida was, this is sad, but we can get on with it. And I think she would have been much happier to have been categorically told that, regrettably, Duncan had a bad infection and he had a defective heart, rather than being left to the suspicion that somebody had deliberately killed her child.
Absolutely. So just as one final follow-up question, we can hope that the system learns the lessons of what has occurred in the Lucy Letby case. We must live in hope that this happens.
Yes.
But if I was to give you a blank piece of paper and a pen, and you could design things that were going to happen to reform the system tomorrow, what would you do?
I think, the RSS Stats and Law group, we are trying to do a lot. We're working on providing training for solicitors and barristers in statistics. There are people who are working on providing that for judges. We're working with groups of the police. I think you have to accept that you just have to persevere. You have to keep offering support, providing more information, and it would be great if Lord Jonathan Sumption was willing to talk to a few more of his colleagues and persuade them that collaborating with people who understand logic and evidence and reason would be quite a good idea.
Yeah, I agree. Well, with that being said, thank you very much for joining me today. I'm ever so grateful. And I want to say on behalf of everyone watching that we really appreciate you speaking out on this. We really appreciate you paying the documentary. I must say you've been particularly candid today. I wasn't sure what you were going to say. I knew I had to ask you about some fairly contentious issues, and you've been extremely generous in what you shared. So I'm really grateful, and thank you so much for your time.
Thank you.
No worries.